Hello and welcome to My Dietitian Journey. I'm Felicia, owner and registered dietitian at Paraz Nutrition and My Dietitian Journey. In this video, I'm going to cover Advanced Beneficiary Notice of Non-Coverage, or ABN, how to integrate this into your practice, and I'll also show you a sample ABN, which you could download from the CMS website. ABN is a written notice that you give to Medicare beneficiaries or patients before an item or service would be furnished when you believe that Medicare probably or certainly will not cover all the items or services. Medicare coverage is very clear for medical nutrition therapy. They only cover for certain diagnoses, so diabetes and renal disease, and they also only cover for a certain number of hours with particular referrals. If a patient has Medicare as their primary insurance and you receive a diagnosis code of I-10, which is essential primary hypertension, Medicare would not cover for the service because the patient doesn't have a qualifying diagnosis. In this case, you would issue an ABN prior to the service being rendered. With an ABN, you do need to have one on file each year and then retain it for a period of 5 years after you've finished with care for the patient, unless you have state laws that require a longer period of file storage. When you're filing a claim for a patient with Medicare who does not have coverage for a specific service, there are particular modifiers that you need to know about for billing. The GA modifier is a waiver of liability statement issued as required by the payer policy. In this case, you are reporting that the ABN was provided to the patient and it is on file. This modifier indicates to Medicare that you have made the patient aware that they will be liable for the service since it's deemed to not be reasonable and necessary under Medicare guidelines. The claim denial for Medicare would be listed under medical necessity denial. The GY modifier is used to indicate that the services provided do not meet the definition of any Medicare benefit. Basically, the claim will be denied even without a modifier. It's not necessary to provide the patient with an ABN in these situations. Modifier GY will cause the claim to be denied with the patient liable for the charges. This modifier may also be used with a GX modifier, where a volunteer ABN was issued for a service that Medicare never covers. The claim in this case will be denied with patient responsibility. Last is the GZ modifier, which is when a service is expected to be denied due to it not being reasonable or necessary. This modifier is used when you did not issue an ABN. If the service is not covered, it would be denied for not being medically necessary. In this case, the patient would not have financial responsibility, so you couldn't bill them for the service. Claims with GZ modifiers are auto-denied by Medicare. The modifier that I use most often is the GA modifier if a patient does not have secondary insurance and will be paying out of pocket, or if they have secondary insurance so that the patient responsibility shows on the secondary claim. So in this case, Medicare is billed first and they deny it with patient responsibility, and then it would be sent to the secondary insurance who, if they have coverage, would then pick up for that responsibility. This is a blank ABN, which was downloaded from the CMS website. As the notifying provider, you would fill out A through C in the header. A is the notifier. You would need to put your name, address, and telephone number, which could also be in the form of a logo with the same information. B is the patient's name, to which you would need to indicate their full legal name. C is the identification number, which is optional to fill in. In some cases, this is the patient's medical record number. You do not want to indicate their social security number or their Medicare ID number. For the body, you will also fill in D through F. For D, if providing medical nutrition therapy, you would specify this as a service in this column. Keep in mind there are multiple blank D fields that you need to fill in to make sure that the ABN is valid. E is the reason for denial, which can include Medicare does not pay for the service for your condition. F is the estimated cost. If you charge $200 for a 1-hour session, you would indicate $200 here. For the options under G, you want to make sure that the blank for the letter D field is filled in. However, your patient needs to check the options in this section themselves. So options here include option 1, I want the D, whatever service that is listed above. In this case, the patient wants Medicare to be billed for an official decision, and they are also acknowledging that they are responsible for the payment if Medicare denies it. Option 2 is that they want the service but do not bill Medicare. For this option, the patient is accepting responsibility for the payment and has indicated that Medicare does not need to be billed for an official decision. Option 3 is that they don't want the service listed above. With this option, the patient is choosing to decline the service. As the provider, you would not bill Medicare, nor the patient, since you are not rendering any services. The additional information section under H is where you can provide more information for the patient. This might be regarding information on other insurance coverage. Lastly is the signature box, which is I, and date, which is J, for the patient to fill in after reviewing all the information in the ABN. This is an example of what a filled-in ABN could look like. A is filled in with the provider information, and B, the patient's. C is left blank, since medical record numbers are not something that I use in my practice. D is filled with medical nutrition therapy service. For the body, you will also fill in D through F. So in this case, medical nutrition therapy service, and then Medicare does not pay for this service for your condition, an estimated cost of $200. After reviewing the ABN, the patient would then check one of the options under the section for G and then sign and date the ABN for it to be valid. I hope the review of the ABN has been helpful for you in your practice. Thanks so much for listening, and reach out if you have any questions.